So today let's see about the venous drainage of the entire body. So venous drainage. So we'll start from below upwards. So starting with the plantar digital veins. So remember the plantar digital arteries were there in the same way. We have a plantar surface and a dorsal surface, right? So starting with the plantar digital veins. Okay. Now from there it drains into the metatarsal veins. So you can see digital veins over here. Digital veins. From here, it drains into the metatarsal veins. Okay, now from there, we have to either we have a dorsal venous arch or else we have a plantar venous arch. Here in the picture, they have shown as a dorsal venous arch. Okay, it is the same. You can see over here. Plantar digital vein drains into the metatarsal veins and then it drains into the plantar venous arch. In the same way, dorsal digital veins drains into the dorsal metatarsal veins and then it drains into the dorsal venous arch, right? Dorsal venous arch over here. Now, coming to the planus venous arch, it again drains into the medial and the lateral plantar veins. Same over here. Lateral end and the middle end of the dorsal or digital veins. Dorsal veins it is. Okay, now you can see dorsal veins of the root, of the foot. So where does it drain? It drains from the dorsal venous arch. Okay, now it comes a little different. From the medial and lateral plantar vein, it drains into the posterior tibial vein. Now at this particular posterior tibial vein, at this particular junction, from the distal third of the leg, there is one more drainage that is happening to the peroneal vein. Okay, and that peroneal vein unites with posterior tibial vein over here. Okay, there is two things which is coming. One was from the plantar digital vein, then other one came from the peroneal vein. And now from the peroneal vein, it joins with the posterior tibial vein. And then it drains as a tibioperoneal trunk over here. Tibioperoneal trunk. Okay. And now one more. There is a dorsalis pedis vein and the anterior tibial vein. These two unites with the tibioperoneal trunk, and then together it drains into the popliteal vein. Popliteal vein. Okay. And now, after the popliteal vein, the blood from there drains into the superficial femoral vein and the deep femoral vein. You can see deep femoral vein over here and the superficial femoral veins. That's how the drainage happens in case of a plantar digital veins. After that, we'll see. But before that, we should finish what happens with the dorsal digital veins. I already mentioned dorsal digital vein. It drains into the dorsal metatarsal veins, and from the dorsal metatarsal vein, it drains into the dorsal venous arch. From the dorsal venous arch, we have two ends. There's a lateral end and a middle end. Now, remember, the middle end of the dorsal venous arch, okay, it drains as the great saphenous vein. Great saphenous vein. And the lateral end drains as a small saphenous vein. Okay, now this small saphenous vein you can see when it comes here, it interconnects with that of the popliteal vein over here. Okay, now when the great saphenous vein drains upwards, it gives lot many branches. It gives branches to the anterior venous tributary in the leg. It gives branches to the posterior arch in the leg, lateral and medial axillary saphenous vein in the thigh, then superficial external pudendal vein, it gives rise to, or it takes a drainage. Its tributaries are superficial circumflex iliac vein and then superficial epigastric vein. So these are the tributaries of great saphenous vein. Now, the great saphenous vein, along with that of the superficial and femoral vein, deep femoral vein, they become a common femoral vein. Okay, it drains as a common femoral vein, and common femoral vein drains into the external iliac. This is what you need to remember. The great saphenous vein from here, as well as the deep and superficial together, it drains as, so this part, Okay, this is a common femoral vein, and this common femoral vein will drain into the external iliac vein or drain as external iliac vein. So this is something which you need to remember. Now, the one question which has been repeatedly asked are about the perforators in the lower limb. Perforators in the lower limb. So remember, we have a Custer or Mays perforators. Very important one. This is a deep to superficial, okay, and that is near the lateral ankle. It's a deep to superficial perforator and near the lateral ankle. Other one is a Cockett's perforators. This is from superficial to deep. So remember, this one is only one which is deep to superficial perforator. Other three are superficial to deep perforators. Okay, Cockett's perforators, that is superficial to deep in the median calf. Then we have Boyd's perforators, that is great saphenous to deep veins just below the neck. And again, we have Dodd's perforators, that is great saphenous to femoral veins. So this is one exception. This is very important. Custer's or May's perforator, that is deep to superficial near the lateral ankle. Other three, that is a Cockett's perforator, Boyd's perforators, and Dodd's perforator. Repeatedly, these questions are jumbled up and gambled and asked again and again in your examinations. Very important, and you need to know about it. Now, let's talk about the upper limb, venous range in the upper limb. Now, again, we'll start from the end. Okay, we have a superficial and we have a deep. Okay, superficial and we have deep. Superficially, we have the dorsal digital veins. Okay, we have digital veins. You can see over here, digital veins. These digital veins will drain as a dorsal metatarsal veins. Metatarsal veins. And then we have a dorsal venous arch. Dorsal venous arch, as in a superficial palmar arch or a deep palmar arch, anything. Okay. Now, next we have a lateral and a medial part. We have a lateral and a medial part. Now, talking about the lateral part, remember, lateral part, okay, you can see the arch over here. The laterally, it goes behind, okay, and then it runs as a cephalic vein. It runs as cephalic vein. And then it drains into the axillary vein. It drains directly into the axillary vein. Hmm? And now from axillary vein, you can see the direct. Goes as a directly, this branch you can see, cephalic vein, directly goes in, over you can see, directly goes into the axillary vein. Yeah? Okay, now, an axillary vein, again, drains as subclavian vein. Very easy. So remember, on the lateral side, it drains as a cephalic vein. Cephalic vein you can see. So here, same, we have two branches. Goes as a drains into the axillary vein, and then it drains as a subclavian vein. Now remember, the cephalic vein and this is the basilic vein. This has a connection, that is a median cubital vein. Talking about the basilic vein, the dorsal venous arch divides or goes into the medial part. Okay, and then it divides as median side. It divides or it drains as a basilic vein. Now basilic vein, you can see basilic vein and the cephalic vein, it is interconnected with the help of a median cubital vein. Okay. Now, after that, again the same. The basilic vein again drains into the axillary vein, and axillary vein again into the subclavian veins. So this was about the superficial part. We're talking about the deep one. You can see there are two. We have a radial one, and we have ulnar vein over here. So remember, these two things, these two will join together. Okay, and they'll join together and they'll form the brachial veins over here. And this brachial vein again will merge into the axillary vein, thus draining all the blood into the axillary vein. And again, axillary vein will continue as the subclavian vein. It's a very easy one. We're talking about lateral tributaries of the axillary vein. That is very important, you should know. Okay, the tributaries of axillary vein are thoracoacromial vein, Then we have a lateral thoracic vein. We have a subscapular vein and an anterior circumflex humeral vein. So these are the tributaries of axillary vein. Okay. Now in the examinations, one particular vein has been asked repeatedly, that is a median antebrachial vein. You can see over here we have a median antebrachial vein. Then begins from the palmar venous plexus. Remember, it begins from the palmar venous plexus. It starts from the forearm and drains into any one of the vein in front of the elbow. That you have to remember. In front of the elbow, it may drain into any. Okay, so and that is called a median antebrachial vein. So this was about the venous drainage of the upper limb. Now, coming into the head and neck. You might find it a little complicated, but do not worry, this is easy. Okay, now we'll start from here. Now remember that from the superior sagittal sinus that begins at the crista galli. Okay, from there, this particular superior sagittal sinus will run backwards till the internal occipital protuberance. Okay, and then it will drain into the confluence of sinuses. Like if this is the skull, from here till that of the protuberance, there is a sinus that is present. And the name of the sinus is superior sagittal sinus. Okay. And over here at the protuberance, that's a confluence. There is a confluence of sinuses, means lot many sinuses are coming and attaching. Okay. From there, we have a right transverse sinus. Okay, right transverse sinus. Okay, and on the other side, that is we have superior sagittal sinus turning into a right transverse sinus. In the same way, inferior sagittal sinus is also there. Okay, that that becomes into a left transverse sinus. Okay, we'll come to that. Before that, we'll see superior sagittal sinus. They run backwards till the protuberance, and then they form the right transverse sinus. Okay, now this right transverse sinus, it drains into the main branch, that is the transverse sinus. And then this transverse sinus drains into the sigmoid sinus. And once it drains into the sigmoid sinus, then it passes to the jugular foramen. Once it comes in the jugular foramen, it becomes the internal jugular vein. Very important, it becomes the internal jugular vein. Okay, now there are few tributaries of internal jugular vein, like occipital vein, middle thyroid vein, superior thyroid vein, pharyngeal vein, and lingual vein. These are the tributaries that drain into the inferior jugular vein. Okay, now remember, this is a main point. Okay, now this internal jugular vein, it drains into the brachiocephalic vein, but remember, it doesn't drain alone. It drains with thoracic duct, it drains with the right lymphatic duct, as well as the subclavian vein. So this is what you need to remember. Okay, now coming back to inferior sagittal sinus. So remember, inferior sagittal sinus, that is from the medial surface of the cerebrum and the vas cerebri. Now it drains into the straight sinus. Now in the straight sinus, not only inferior sagittal sinus, but also the great cerebral veins of Gales also drains into the straight sinus. So from the straight sinus, it drains into the left transverse sinus. Remember this much. Now the right and the left transverse sinuses are interlinked with the communicating vein. This is very important. Okay. Now there is one more thing which you need to remember. That is the supratrochlear and the orbital veins. Supratrochlear and the orbital vein, they drain into the angular vein. Okay. And this angular vein again drains into two veins. That is one is the superior ophthalmic vein, and other one is the facial vein. Okay. Now these two, superficial ophthalmic vein and the facial vein, the main aim of these two veins are to drain to the cavernous sinus. So superior ophthalmic vein will directly drain to the cavernous sinus, but facial vein, it will drain first into the deep facial vein, then it will drain to the pterygoid venous plexus, and then finally, with the help of emissary veins, it will drain to the cavernous sinus. This is how it drains. Now, there are other few veins that drain into the cavernous sinus, like sphenoparietal sinus. We have a superficial middle cerebral vein. We have few inferior cerebral veins as well as middle meningeal vein, importantly. So these four again drains into the cavernous sinus. So if someone is asking which are the main veins that drain into the cavernous sinus, it should be facial vein, superior ophthalmic veins. Okay. Now cavernous sinus again they give two drainages. The first one, it drains into the superior petrosus sinus. That again goes and drains into the transverse sinus. Okay. Now, there is one more directly drainage into the interior or internal jugular vein, that is through inferior petrosus sinus. So, cavernous sinus goes into the inferior petrosus sinus and then it drains into the internal jugular vein. This is one more method of drainage. Okay, so these were the main things which you need to know about the venous drainage of the head and neck. Now, talking about we have not spoken about the subclavian vein over here. So, talking about subclavian vein, first thing we need to remember is about the external jugular vein over here. You know, internal jugular vein, we already know. It drained all the things from the superior sagittal sinus as well as the inferior sagittal sinus. They came and the blood was drained into the internal jugular vein. But there are few things which drain particularly to the external jugular vein also. Okay, now that are suprascapular vein, posterior external jugular vein, and the transverse cervical vein. These three will directly go and drain into the external jugular vein, or you can say it is a tributary. Apart from that, we have an anterior jugular vein. Okay, now anterior jugular vein will divide into two. First, little of the blood it will drain to the jugular venous arch, and the majority of the blood it will drain into the external jugular vein. Okay, now one more thing. The superficial temporary and the maxillary vein. Okay, these two will divide into or will drain into the retromandibular vein. Okay, now this retromandibular vein will drain into two again. One is a posterior branch and one is an anterior branch and one is a posterior branch. This posterior branch along with the posterior auricular vein again will drain into the external jugular vein. Okay, now here the anterior branch will drain as a common facial vein, and the common facial vein will directly when drain into the internal jugular vein. So this is what happens. Okay, now coming to the external jugular vein and the internal jugular vein connection. Remember, it is communicated through a particular vein that is known as the oblique jugular vein. So, thus, this is completely over. So what you need to remember is in the head and neck, exactly from where it starts and where it ends. Remember, it starts from the sagittal sinuses, may it be superior sagittal sinus and inferior sagittal sinus, and it ends into the brachiocephalic vein. Now let's see what happens to the brachiocephalic vein. When all the blood from the head and neck drains into the brachiocephalic vein, then we know we already have a right brachiocephalic vein and we have a left brachiocephalic vein, right? So the left superior intercostal vein and the second, third, and the fourth left posterior intercostal vein, the blood from there will drain directly into the left brachiocephalic vein. It will drain into the left brachiocephalic vein. Now, what are the veins that drain into the right brachiocephalic vein? They are, the first one is the musculophrenic. From the musculophrenic vein, it will drain into the anterior thoracic vein. From anterior thoracic vein, it will drain into the internal thoracic vein. And from the internal, we have few other branches together with internal. That is the first posterior intercostal vein, may be right and left. Then we have a thymic vein. We have a inferior thyroid vein as well as a vertebral vein. These four together will, these five together will drain into the right brachiocephalic vein. Now, from the right brachiocephalic vein as well as the left, together it will join, and now it drains into the superior vena cava. Okay, superior vena cava. Now, we'll stop here. We'll see what are the other branches that drain into the superior vena cava. One, we already know, that is a brachiocephalic vein. Other one is the right subcostal and right ascending lumbar veins. Okay, that one will not directly go and drain the superior vena cava, but it will drain into the azygous vein. So first one is the right subcostal and the right ascending lumbar vein together will drain into the azygous vein. Okay, from the second, third, and the fourth, right posterior intercostal vein. Left posterior intercostal vein, we know it drains into the left brachiocephalic vein. But second, third, and fourth, right posterior intercostal vein, it will drain into right superior intercostal vein, and then that will go and drain into the azygous vein. Okay, now there are few other, that is the left ascending lumbar vein along with left subcostal vein together. This blood together will drain as hemiazygous vein. There are few other veins from where it gets, that is the lower three left posterior intercostal vein. Remember, lower three left posterior intercostal veins. From there, as well as the addition of these two together, it will drain into the hemiazygous vein. Okay. Now there is a connection between the hemiazygous vein and the left renal vein. Okay. So from the left gonadal vein and the left suprarenal vein, these two will drain into the left renal vein. Now these both have a connection, and together it will go and drain into the azygous vein. Okay. Now there is one communicating uh, vein between the hemiazygous vein and an axillary azygous vein. Okay. Now thus this communicates that some blood directly goes into the azygous vein and some goes into the axillary azygous vein. And axillary azygous vein again gets the blood from fifth and eighth left posterior intercostal vein, and together it drains into the azygous vein. Now there are few other tributaries of azygous vein, that is esophageal vein, pericardial vein, and the mediastinal vein. All this together, the blood which will be collected in the azygous vein will be drained into the superior vena cava. Now, from the superior vena cava, we know it goes in the right atrium. Correct? So, right atrium. We'll stop over here now. Again, we'll see what happens from where the blood comes from the inferior vena cava. Okay. Now, there are few veins that directly drains the blood into inferior vena cava. You should know there is a hepatic vein. We have the first and the second lumbar vein. Okay, that again drains to the ascending lumbar vein. Then third and fourth lumbar vein, we have a right gonadal vein, we have an inferior phrenic vein, we have right renal vein, as well as we have a right suprarenal vein. These will go and directly drain into the inferior vena cava. Okay, now next one, a little more downwards. We'll see the lateral sacral vein. Remember the lateral sacral vein, superior, inferior, a superficial inferior gluteal vein. We have a internal pudendal vein. We have obturator vein. We have vesical venous plexus. We have middle rectal vein, and the vaginal and uterine veins in females. All this will drain into the internal iliac vein. Plus, we have pubic veins, deep circumflex iliac vein, and the inferior epigastric vein. These will go and drain in the external iliac. Now, the blood in the internal iliac and the external iliac will together drain into as common iliac veins. Remember common iliac vein. The common iliac vein we have common iliac, we have left side left common iliac, right? Now, they will also have received blood from ascending lumbar veins and iliolumbar veins. And left will again receive from medial sacral vein. So together, this will go and drain into the inferior vena cava. So this was about the venous drainage in the thorax and the abdomen. So remember, it starts from the brachiocephalic vein. Again, from downwards, from the external iliac and the internal iliac together, it comes into the inferior vena cava. And from upwards, it comes into superior vena cava. And then it drains mainly into the right atrium. Okay, so right atrium is a reservoir for that. So coming to the inferior vena cava. Okay, now inferior vena cava, we know Well, let's see what and all, how it drains. A portocable system actually. So we know the things which over here we have already said, right? All the things that drain into inferior vena cava. We'll see. So, so the starting is with the splenic vein. Okay. Now, when I draw two lines, that means it is a anastomosis. Remember, it is an anastomosis that will deal later. Okay. The first one we'll see with this the splenic vein. Now, remember, splenic vein will. There are few. You should remember about the arteries. That will be very easy for you. Okay. So, splenic vein, they will get its drainage from the short gastric veins and the left gastroepiploic vein. Okay, and as well as the inferior mesenteric vein. So these three will drain into the splenic vein. But inferior mesenteric vein again will receive the blood from left colic vein, sigmoidal vein, and the superior rectal vein. So these three will drain into inferior mesenteric vein, and in turn, inferior mesenteric vein, the blood will drain into the splenic vein. Okay, this is about one part of it. Clear. Now, the blood from the splenic vein, along with that of the superior mesenteric vein, will drain into the portal vein. This is what you need to remember. You know what are the things from where the blood comes in the splenic vein. Now, from the blood from the splenic vein as well as the superior mesenteric vein together will drain into the portal vein. So, from where does superior mesenteric vein get the blood from? That is the right gastroepiploic vein, middle colic vein, ileocolic vein, ileal vein, as well as jejunal vein. So, these will drain into the superior mesenteric vein. Now, blood is being collected in the splenic as well as superior mesenteric vein, and together it will it will drain into the portal vein. Now, talking about a little of the portal vein, it has two branches. That is the right branch and left branch. So, right branch will receive its blood from the cystic vein, and the left branch from the paraumbilical vein. Okay. Now, these two together into the portal vein. Now, there are a few other branches. There is the left gastric vein will also drain into the portal vein and the right gastric vein. Together, we have blood collecting the portal vein. Now, the blood from the portal vein, it will be it will drain into the portal venules, which are situated in the lobes of the liver. From the portal venules, it is drained in the portal sinusoids. From the portal sinusoids, it is drained in the central vein. And then it forms the hepatic vein, which will drain directly into the inferior vena cava. So this is about the portocable system. But here you need to know about a little about the anastomosis. I mentioned over here splenic vein, right? Splenic vein and left renal vein, there is an anastomosis that is happening. The same way, left colic vein and left renal vein. Superior rectal vein and middle and inferior rectal veins, there is a anastomosis that is happening. In the same way, here you can see paraumbilical vein has anastomosis with all the four arteries that is superficial, so not arteries, veins. Superficial epigastric vein, lateral thoracic vein, inferior epigastric vein, as well as superior epigastric vein. Okay, so these are the four veins in which it has an anastomosis. In the same way, esophageal branches of the hemiesophagus also has an anastomosis with left gastric vein. Okay, now there are other sites of anastomosis also. They are bare area of the liver, falciform ligament, and fissure for ligamentum venosum. These are the other sites. The most important ones I've mentioned over here. So it starts from the splenic vein, goes adds along with that of the superior mesenteric vein, drains in the portal vein. From portal vein through hepatic vein, it drains into inferior vena cava. This is just about the portocable system.